All right, welcome back. Dr. Andrew Gorecki here, Movement RX, teaching you everything I know about remote therapeutic monitoring. Okay, so in this lesson, we're going to talk about RTM Decoded. What is it? Really, what's the kind of the 30,000 foot overview of what it is? Why is it important? And really kind of just give you an overview of it because most people really have no clue what the heck it is. It's not telehealth. It's something completely different. So, if you kind of look at my diagram here, and we start at the top where, as a therapist, physical therapist, whether you're in an outpatient, in whatever setting you're in, you're evaluating the patient, you're creating a plan of care, right? And that doesn't change. So you do that like you normally would, whatever your patient population is. The second step is if we follow our arrows to the right in this clockwise circle, the in-clinic physical therapist is also going to create a home exercise program, right? That's pretty typical for most settings, most physical therapists. In this case, it's going to be done moving away from the old, like printing a picture or just telling, showing, demonstrating, to moving to a digital platform. Has to be a software that the patient has access to. Now, it could be a browser-based software, it could be an app on the phone or a device, but it has to be a digital software program that is able to create the home exercise program and then share data and track that data, which we're going to talk about in a little bit. So then once that's done, now the remote therapeutic monitoring begins, right? So we have uh, somebody, whether it has to be a physical therapist or a physical therapy assistant in the state that they have to be licensed in the state that you're in or the patient's in, and they have to do this monitoring of the compliance of the home exercise program. That has to be done outside of patient care time. So it could be done anytime as long as it's outside of patient care time. And so that remote, we call them remote care provider, is really the goal is to support the patient when they're not in the clinic with you and hold the patient accountable for their participation with their instructions you've given them to do at home when they're not seeing you. So they're there as like a motivational interviewing specialist, a coach, um, and essentially they're there to just motivate and encourage the patient. And so the goal is to get that patient to do more of their home exercise program, understand that we care about them and we want them to continue to come to their visits. Ultimately, we want to increase the outcomes and the participation of the patient so they get better outcomes and they avoid expensive things like procedures, right, and imaging. So think of it more like a coaching role. That remote provider is, we train ours in motivational interviewing. So there's tons of books written on this, but it's really asking the right questions to get the patient to self-motivate, not to tell them what to do, but to guide them down the path so that they can understand the importance of doing what the physical therapist prescribes, right? Ultimately, the goal is to increase participation in the home program, improve patient outcomes, and avoid things like surgeries, medications, and injections. So, we monitor the compliance of the home program. We hold the patient accountable. It also, Medicare requires that this remote provider outside of patient care time contacts the patient once a month, either via video call or a phone call. And in that scenario, that also is a great opportunity if the patient is like post-surgical to catch any red flags. That's happened. We've had that happen. It's a great benefit for the patient and for us. And really, the patients will say to you that it is enhancing their experience with your clinic. No one else is doing this. Feels like you guys really care about me. So those are our elements. Now we're going to talk about the codes and the rules that are associated with it, but it's important to recognize that you really have to follow the CMS rules, your state practice act, and then the FDA is who kind of regulates these devices or these software programs. So let's talk about the codes. There are 4 new CPT codes that were created for physical therapists to to submit related to remote therapeutic monitoring. So the first one is the 98975. That is an initial setup and it's a one-time code. So you setting up the HEP platform with the patient, educating them on how to use it, that is going to produce the first code. Now the second code, this 98977, this is a code that is a monthly code And this is for the patient having access to the software, right? As long as that software is transmitting data, let's get to the details here. There's a more detailed view, 98977. As long as the software is transmitting data 16 days in that 30-day period of time, then we are able to bill for this device code, this RTM device code. So that's great. It's a once a month thing. And these first two codes have nothing to do with really somebody providing remote monitoring. It's just the technology. It's like reimbursement for the technology, recognizing there's costs associated with software programs. Now, these last two codes are actually where we get into the timed nature of actually monitoring the patient's compliance. So the first 20 minutes, it has to reach 20 minutes. It's like every other CPT code where there's time based. This is actually the remote provider doing the monitoring of the HEP platform and anything else that's going to help the patient meet their goals. So this is something that can be billed at the end of the month as long as 20 minutes has or more has been reached and a two-way audio communication has occurred between the remote provider and the patient. Essentially that check-in that's holding the patient accountable, right? For whether they're doing their HEP or not. And then any additional 20 minutes is going to be the 981 code. That is also the same rules apply. There is no limits to how much you can produce here as long as it's helping the patient meet their goals. So that's kind of the quick rundown of the actual CPT codes and the rules that are associated with this. Now, you're probably thinking, holy cow, like I'm going to have to track all that calendar month, 30 days, data transmission, phone calls. Well, you should have a software program for this HEP situation that does it for you. Right? That's the big benefit of having a digital HEP platform that is RTM qualified or FDA approved, which has to happen. You have to have an FDA approval to use the software program, or the software program itself has to be FDA approved, has to meet the requirements that the FDA sets forth. Now, if we look at what this is looking like, and again, remember, I'm teaching you what to do here, but I also do this for my own private practice, and I do this for many clinics across the country where we provide them the software that we've created, and we also then provide them, if they want to, a remote provider that is we hire and train and manage, and they actually generate the time because most clinics don't have the time, right? They don't have extra 60 minutes per month. And that's what we on average do. It's about 15 minutes a week or 60 minutes a month on average. We'll typically monitor for the 2 months on average, depending on your plan of care lengths and things like that. But this is our average. So we're on average generating 1975, 2977s because it's 2 months, 2980s because in the first month we're generating 20 minutes, right? Second month we're generating 20 minutes. And then we're also generating an additional 4 because we're doing 60 minutes a month. So you can kind of see the math. This is going to be different per state, but this is Medicare reimbursement in Michigan. So you can see we're generating about $333 per patient, right? That's pretty significant when you consider and this would be profit, right? I guess you have to pay your remote providers, but this is a pretty significant increase in our reimbursement for physical therapy. So some of the requirements, again, this device has to be able to transmit data from the patient's app, right, or account to the remote provider's account. The device has to be FDA approved, has to be a licensed PT or PTA. No data transmission. As long as there's data transmission, it's not patient engagement, right? It's not, well, the patient has to log in 16 times. No, it's data transmission. So even though the patient didn't do their homework today, that data coming back to me is still relevant and important, and it helps the remote provider hold the patient accountable even more. The length of the HEP program doesn't matter. It could be a 30-second video. It could be 50 30-second videos. The first two codes are generated for the installation, education, and setup of the device, and then the patient maintaining that access. These are time-based codes for the monitoring. Must be outside of patient care time, and there must be communication with the patient once a month. Okay, so Now, there is a communication requirement from the remote provider, right? That remote provider has to communicate with the patient, but the remote provider also has to have access to communicate with the supervising or evaluating physical therapist. The cool news is all that time of communication with this remote provider, whether it's with the patient on the phone or whether it's with the therapist in person or on the phone or email or text or whatever it is, all that stuff is monitoring time. So it actually adds up to your 20-minute thresholds. This is the statement by the FDA, right? So the FDA says that this software is a medical device. It's a mobile app, right? And it could be a web-based as well, but it has to be not a hardware device, and it has to be intended to be used for one or more medical purposes that perform these purposes without being part of a hardware device. So it's not a wearable, right? It's not a Fitbit or a whatever. It's an app or a software program that is designed to track participation and data. All right, so some of the things that are important to recognize are the documentation requirements. Again, so you have really two things. You have what is the therapist who is working with the patient and developing the plan of care? What do they have to do for documentation? The good news is it's very little. And then what does the remote provider have to do for documentation? And so, again, the digital HEP platform should allow the remote provider to monitor and track every minute that they're monitoring and then explain what they did, whether it was a phone call, whether it was communicating with a therapist, whether it was reviewing chart notes, whether it was chatting with the patient, all that stuff should be in the digital HEP platform and logged. Your time has to be logged. From a therapist standpoint, really it's setting up the plan of care to simply state that you're going to be doing remote monitoring and why and what the goals are for that. We're going to talk about that in another lesson, but just recognizing that the therapist documentation is pretty little. The remote provider has a little bit more documentation you need to do, but it should be saved and generated automatically in the HEP platform. So what does monitoring really look like, right? So really Medicare says that remote monitoring is you're monitoring anything that's going to help the patient meet their goals. So if I'm a remote provider and I've never met the patient before, right? I might not be working with the patient. I need to make sure I know everything about the patient before I make that phone call. So I'm going to review things in the EMR system, chart notes. Have they been coming to their appointments? What was the evaluation? What does the referral say? Was there any images? What's the status, the progress of the patient? I'm going to look, of course, in the HEP platform at video views and any data that HEP platform is going to share with me. Sometimes you'll see things like pain scale, steps as the patient's taking each day, any communication that's happened between the, in that platform. There's oftentimes chatting features where the patient can chat back and forth with the remote provider. All that stuff is going to be included as monitoring time, right? So important to recognize that, and hopefully this gives you kind of a brief overview of what the heck RTM is, and look forward to the next lesson.